Okay, so we're going to try to get through as much as possible. I thought I'd get this chapter done in 3 videos. It's not a very long chapter, and it's not terribly difficult, and not terribly stimulating. And I'm already tired today, so I apologize for any slurs in my voice or anything like that. I'm just, not really feeling up on the, and this is not a great subject either. So let's move on, all right? And it's important, again, because you're going to use these actions when we describe what muscles do, all right? So we're going to say, flexion, extension, abduction, adduction, rotation, all right? And then we're going to make it specific by saying of what. So do pay attention to that when we talk about that with the muscles. So this process of abduction and adduction, so again, paired, opposites. When you abduct something, you take it away from the midline of the body. And when you adduct it, you bring it towards. So here I tell you that condyloid joints can do this motion. Saddle joints can do this, and so can ball and socket. But plane and hinge cannot, right? For example. So here, again, circumduction, which I said was not paired, so we don't have an opposite thing here, is really condyloid, saddle, ball, and socket. So we can put these together for what they have in common is the type of joints that do them. But circumduction is actually about a 360-degree rotation of a body part. So it's really easy to see this with the shoulder. The leg can do this, the fingers can do this, right? As I said, condyloid, saddleoid, the thumb can do this. Saddleoid, excuse me. Saddle. Oh, I told you I'm tired. Alright, so general movements that we do, rotation, again, there's not a pairing to this on this one, though some rotation is described as medial or lateral, and that is this is especially when we're talking about the entire upper limb or lower leg, as they show you the leg, or excuse me, lower limb in this cartoon. So rotation is you're turning a body part on an axis. So pivot joints do this very well. All right, and really we'd only give rotation to a pivot joint. So the atlas and the axis and the ulna and radius. Now, if that rotation is directional, right? So we actually have the medial or lateral rotation, which again that's just towards the midline or away from the midline. Well, then it's ball and socket joints that do that. They're the types that would do that. All right. Special movements of the foot. So again, when we use these terms, we automatically know we're talking what body part we're talking about, and technically, using the name of the part is not as important. But please be thorough when you answer questions about muscle action. So the plantar surface is right at your bottom of your foot. So plantar flexion is standing on your tiptoes, basically. And dorsiflexion is then bringing the surface of the foot closer to the shin. Okay? And these are done by that ankle joint, which is a hinge, right? So between the talus and the tibiofibula. And eversion and inversion are also generally talking about the foot, and you see them here. So eversion is when we move the bottom surface, the sole or plantar surface, laterally, so it's moving toward the side here. And when we move it medially, right towards the inside here, it is called inversion. So this is a plane joint between the tarsals that lets me do this. Right? And then another special joint here, not of the foot, is that of the thumb, and that's opposition and repositioning. So the thumb's ability to make contact with fingers, right, and then move away from them, straighten back out, is called opposition and repositioning. All right? The scapula and mandible do some special movements. So protraction and retraction, and this can be scapula or the mandible. So here we're looking at the mandible, right? And the protraction is moving forward, and we have gliding here, so it's on a plane, on a the level of the plane. So moving along this plane in an anterior direction, and retraction, of course, is moving back. So here there's the jaw jutting out and returning. And the scapula can do this as well. Elevation and depression, here the scapular mandible, and if it's a mandible, we do this, of course, for talking, eating, and so forth, but the scapula, as shown here, if I elevate, I bring this up, right? I bring the body part up. If I depress, I'm resetting it, bringing it back down. Then pronation and supination, this is a description for that, again, that pivot joint between the ulna, radius, and making contact with the humerus too, so the elbow joint itself. So when you're pronate, right, you are face down. When you are supine, you're on your back. So when we're in anatomical position, a movement that we call pronation is to rotate the forearm, right, through that pivot joint, so the palm is down, so face down. And when you supinate, you are resetting it. So again, we use the term supine, we're talking about on your back, and you can see how that would work. And when you pronate, you're putting your right surface towards, downwards. So what we consider surface from anatomical position. All right? So we end this chapter looking at some examples of synovial joints. So I have here vertebral column, the temporomandibular, TMJ, right? Shoulder, elbow, hip, knee, fingers, fingers and toes. Sorry, ankle and foot. I'm just thinking of that old childhood, song. Anyway, all right, gotta do something. These are the jokes, right? So the vertebral column, right, is the joints between the individual vertebrae, and there are a number of joints, right? So between the bodies, this was still a cartilaginous joint, right, called the intervertebral disc, a symphysis. Between the facets, we have, right, these flat facets. Well, that's a plane joint, right? And it's not going to have a whole lot of movement, but it can move, and that gives us that range of motion in the back itself. So in the cervical, I hope you recall, in the cervical, we do see the two special cervical vertebrae here, the atlas and axis, and they do pivot, so that's not what we're talking about here, right? We're talking generically between C2 and 3, 4, 5, and 6, 7, right? So the cervical vertebrae have flattened horizontal facets. So we get some flexion, extension, and rotation, actually, with this. So again, that neck moves quite a bit when you think about it, is what I'm telling you. And you probably already knew that. But now I'm just telling you why. Right? The thoracic region, then we become flattened facets vertically. So we limit that flexion extension, but does allow some rotation of the trunk, if you will. And then the lumbar, I said those facets begin to curve inwards and outwards, and they interlock. So there's very little rotation, but you can get some flexion and extension here because of that. All right, the temporomandibular joint, so between that right mandibular condyle in the mandible and the mandibular fossa, right, here in the temporal bone. Classic synovial joint, and everything else in the skull is pretty much a fibrous joint and immobile. So this joint, because it's rounded into a shallow curve, you get elevation, depression, protraction, retraction, excursion, which is a side-to-side movement. You get gliding, right? It's considered both a gliding and a hinge joint. I often call it condyloid because it really, to me, it is. But again, follow what your book says, but understand I'm going to write your test, right? So your condyloid is so rounded, so you get a little bit of a lot of different types of movement here, and that's good because that assists us with our chewing. So dislocation occurs if this moves anteriorly, right? So if it moves in front of the tubercle, we've really magnified in too close to see that. But if that jaw moves too far forward, it's going to come out of the joint cavity, and we'd say you're dislocated. All right, the shoulder joint has a lot of cool features. This is the most mobile joint we have, right? And this is the head of the humerus, that nice rounded head, into a very shallow glenoid cavity in the scapula. And so this is enhanced by a loose joint capsule, so you have a lot of motion that's allowed through here. There are a whole lot of different tendons and ligaments. There are some bursa to reduce friction here, and ligaments, again, that are trying to keep the joint, the bones together so they don't dislocate or displace. So this is considered a ball and socket joint. Lots and lots of movement. And we include flexion, extension, abduction, adduction, rotation, and circumduction, the big ones. They're all done by this joint. Right? So, again, we see some classic features of the synovial joints here. Right? But we want to look at a few specifics. Note here, though, on tests I often have asked, I've given a name of a ligament and said, where would you find this? Well, it turns out, of course, that the names of the ligaments really reflect where they are found. So do use that to your advantage, okay? So you've got acromioclavicular ligament, right? You've got the coracoacromial ligament. So subacromial bursa, so that's going to be between the acromion back there. So in this, I thought it was the skin, but it's hard to tell from this picture. So now, lots of features here in the shoulder joint. Say it's ball and socket, and we get lots and lots of motion. All right. So when we look at ligaments, borrowed this picture from the Holes book. It shows a few of these in a different perspective than the OpenStax did. So we don't have the humerus in place here. We're looking at the side to get this feel for the coracoid anterior, posterior, acromion process here. And there's a number of fibrous joints that really also hold this together and keep the humerus and the scapula in association so it doesn't dislocate. So examples of ones I'd want you to know: the coracohumeral. So again, in the name, you know that this joint's involving the humerus and the coracoid process. And then the glenohumeral. Well, the glenoid cavity is an incredibly unique thing. It was on one of the other, right?